Good day, everyone. We are here at Barangay Health Center. I am Kristen Quiñones. I'm Christine Divase.
I'm Andrea Aben, and I'm Desiree Cosilio. Jennifer Garcia.
Today, we will be having a short interview with Ma'am Pauline Pitaliano, registered midwife under the Rural Health Midwife Program of DOH. She is currently assigned here at Barangay Buena Vista, Presentacion, Camarines Sur.
Good morning, Ma'am Pao. It's lovely to meet you. Thank you for taking time to meet with us today. We are the college students of Fatima School of Science and Technology, and we are here to gain some more knowledge from a registered midwife about some maternal and child care program.
Welcome to Barangay Buena Vista and to our center.
So we have some questions listed here, and I'm going to start with the first question. Department of Health has a lot of healthcare program. As a midwife, what do you think is the most important or should be given the first priority among the others?
So, as a midwife, I think one of the program that must be given priority by the Department of Health is the maternal and child care.
Why do you think that program is the most important?
Well, because this program encompasses a wide range of services and initiatives aimed at ensuring the overall well-being of the mother and the baby.
This program, how would you handle a difficult situation in performing the activity?
So, handling a difficult situations in maternal and child health care as a midwife, it requires a combination of course, our clinical expertise, communication skills, and emotional resilience. So, when we face difficulty, we just have to focus and do not let the difficulty affect or hinder our services that must be given to the patient.
For you, Ma'am, when it comes in childbirth, what is the particular challenges or situation you have encountered and how did you manage?
I have this special experience that I think that I will never forget because this experience helped me become more confident inside the delivery room. So this was way back 2018, I think, when our senior midwives weren't there. They were our supervisors inside the DR. So they were not there that time because they were attending a demo training. So we were the one left at the RHU to handle simple checkups and do the delivery because our RHU has a buy-in. I don't really remember the exact date, but I have on that day I have a successful delivery. I have handled a successful delivery. So I went home to rest, but I haven't even seated when my phone rang. And I saw that it was my team leader calling me to come back. She said, I have to come back because there's a pregnant mother that is about to give birth. So I came back and the first challenge in that experience is that the patient has no baby book, which means she has no checkup, even one checkup. So there's no ultrasound. So there was nothing for us to look for her history. So we still received her despite everything. And as we entered the delivery room, first is I tried to do the loopholes to know the presenting part, if it is cephalic or breech or transverse, and especially the heart rate of the baby. But I did not finish that because the mother was really screaming in pain. So I decided to put on my gloves, and I didn't even finish putting on my gloves. When suddenly she cried, and there it was, a surprise when I was hoping that it was cephalic, but it was breech because the presenting part that is expulsed during that time was a butt. So I was just thankful that time that the baby was really small. And because I was nervous that the head might not come out if it was a big baby. So but thankfully it was a small baby, and that was a smooth breech delivery. So in that kind of situation, the important thing is to not panic and just focus. That's it.
So, in the barangay, how do you ensure that pregnant women receive adequate education and support regarding maternal health and nutrition?
So then first and foremost is the regular prenatal checkup. Before ANC, it is important to 1 year old, but for me, I encourage my patient to have their check-up monthly, the regular monitoring. And aside from the prenatal, giving continuous IEC to the patient. Well, in nutrition, we give ferrous sulfate and folic acid. Giving calcium carbonate, especially on the second trimester. And we also give deworming meds. These are important when it comes to the pregnancy nutrition. I also conducted recently the bonus class. I always do that twice a year. That is to give more knowledge for their preparation, for their as they are about to give birth. So there we do a simple discussion regarding the importance of prenatal checkup, especially the early detection of complications during pregnancy, postpartum care, family planning, and the exclusive breastfeeding.
So, Ma'am Pao, can you elaborate us how do you prioritize patient safety and advocacy in your practice as a midwife?
So as a midwife, I prioritize my patient safety by adhering to some principles and practices that will help to ensure the well-being of both the mother and the baby. So first is, as a midwife, I have to stay updated with the latest guidelines and protocols in maternal and neonatal care to apply it on my everyday duty. So second is the effective communication. For me, it is important to provide clear and comprehensive information to the patient about their health, the birthing process, and any procedures or interventions. And I also have to be an active listener to understand my patient's concerns, their queries, and questions. And being an active listener, I think, is a better way to gain my patient's trust. Third, I have to ensure that my patient understand their options and their choices when they face potential risk and its benefits for the different interventions or choices that they have. And as a midwife, I have to respect whatever their choice may be, regardless. What's important is I give them the important details in helping them to arrive in a good choice. So, fourth is to develop care plans tailored to their specific needs, because some patient has plans tailored to the specific needs and circumstances of each patient. So the care plan will depend on their situation, if they are normal or high risk. And I also have to consider their physical, emotional, and social aspects of care to address the overall well-being of the patient. So fifth is, during prenatal checkup, I have to be able to identify the potential risk early through thorough assessment and regular monitoring to implement a timely intervention and when necessary to prevent complications and ensure their safety. And last is to strictly adhere. So for me, confidentiality is important and privacy as well. This to protect the patient information and make decisions based on ethical principles, prioritizing the best interest of the patient, not making a list. Kung ano yung information mo sa patient, hindi mo yung pwede share sa iba. Kayo-kayo lang. So, confidentiality and privacy of the patient is important. So, I think by integrating these practices into daily routines, I think as a midwife, I can ensure a high standard of patient safety and advocacy, fostering a supportive and secure environment for expectant mothers and their babies, for their families.
Thank you so much, Ma'am Pao, for your time. And we learned a lot today, especially about the maternal and child care program here in Barangay Benavista. I can say that pregnant women here are taken care of, right? And so by prioritizing maternal and child care, the Department of Health can make substantial strides in improving health outcomes, ensuring that mothers and their children receive necessary care and support during the most critical periods of their lives. This not only benefits individuals but also has a profound impact on health and development of the community as a whole. Again, thank you, Ma'am Pao. Thank you for your time.
Welcome.